Good evening, everyone. I'm Dr. Marty Ross, and this is another Conversations with Marty Ross MD tonight. As you all know, this is a webinar where we're going to discuss Lyme disease, and no 2 weeks are ever the same because you create the webinar with your questions. I am always interested to see what you have in store for me, and I bet you don't let me down tonight. So the way that this works, for those of you that are new, there's two ways you can participate. Number one, you can write a question to me. And the way to do that is there's a chat box, I think, on the lower right side of the screen there, and you write your question to me. The only thing I ask, try to be shorter with your questions. We're starting to get some very long ones, and it gets to be hard to do in this kind of a format. So this format works better for like concerns over one or two ideas rather than writing out your whole health history and having me try to solve issues that way. This format does not work for that, okay? And then the other way to participate is to see or hear the questions that that others have and see how I respond to those. I use the questions as a starting point to explain a lot of things. And so as I usually do it, I will do that again tonight for you as well too, okay? I am creating a recording of tonight's webinar sometime tomorrow morning, usually by around 9:30 a.m. Seattle time, which is Pacific Standard Time. I send that email out to you. If you've registered for this, you are added into my email bank, and so I will send it to you with that information, okay? And then there is another webinar next week, and I currently have one scheduled for the week after that too. So if you think you're getting, or if you enjoy what you're getting here, if you're getting good information, feel free to come back. The other thing I request you do, share this information that we're doing, share what we're doing here. My goal is to help as many people living with tick-borne illness as I possibly can, and I need some ambassadors like you. So if you find this helpful and you're in Lyme disease support groups, spread the word so other people might start joining us here, and spread the word about the information I have at my Lyme disease information site too. I'm always looking to expand the number of people that I can help, okay? All right, I invite you to help me with that. Thank you. All right, so without any further ado, I think we'll go ahead and get started. One thing about the questions, if you are, excuse me, if you are participating in the live version, you're actually going to get to read the questions on your screen. They do not show up in the recorded version, however, so I will read them out loud so people know what we're talking about, okay? All right, let's go ahead and get started here. All right, this first question is from Sally. Hold on, everyone. I just swallowed something down wrong there, so just a second here. All right. Sally says, hi, Dr. Ross. I would like to know the average length of time it takes to eradicate each of the three forms of Borrelia and to eradicate Bartonella, Babesia, Mycoplasma, and Epstein-Barr. Okay, so when it comes to Borrelia, there is no differentiation on how long it takes to get rid of the different forms. So Borrelia, everyone, Lyme, exists in three forms. There's a spirochete, there's an intracellular form that lives inside of your cells, and then there's a microscopic cyst form of the germ. To add another layer of complexity to it, the spirochetes, the kind that live inside your cells, and the cyst all can be in a growing state, or they can be in a hibernator state, and we call those hibernators persisters, okay? All right, but keep in mind, persister is not another form. Persister is part of the growth state, all right? So when we look at Borrelia, there's no distinction made between how long it takes to get rid of one form or another. But on average, when somebody has chronic Lyme, it takes about 1 to 2 years to either eradicate the infection or to knock the germ load down enough that it's not impacting you severely, okay? That is based on my own experience. It's also based on studies that were done by LymeDisease.org. LymeDisease.org has a research arm where they basically have a bunch of people in a data bank. I think they're up to almost 19,000 people now. It's called My Lyme Data. And they periodically go out and query people. And a number of years ago, they did a study asking, what did it take to get you well and how long, okay? And what was shown in there is that the people that got well were people that tended to use antibiotics. Number two, they were people that had a Lyme literate provider that could help steer them through the complexities of the illness. And number 3, when it came to Borrelia, they treated for over a year to 2 years, right? And that fits my experience as well too, okay? Now, when it comes to Bartonella and Babesia, in my experience, for 85% of people that I treat with those illnesses, that in general, we can clear the Bartonella in about 6 months, 85% of the time. And Babesia, we can clear in about 5 months, 85% of the time. That means there are 15% of people that get those infections that go on to develop complex illnesses that can take a year or more to treat, okay? And there's no way of knowing at the beginning when you start treating somebody, are they going to be in that 85% of people that respond really well, or be in the more long-term group, okay? Now, when we treat all of these infections, meaning Borrelia, Bartonella, Babesia, there is a chance of eradication. The problem is we don't have a test that proves we have eradicated. It is also possible that when we get somebody well, that maybe what we've done is we've knocked the germ load down enough that the immune system is able to come in and keep these germs under control, all right? Now, when it comes to Epstein-Barr virus and Mycoplasma pneumoniae, these are common infections that are found in healthy people. And so when we find evidence of them in people living with tick-borne illnesses, it doesn't mean they're causing the problem, all right? Because again, as I said, we find the majority of cases of Mycoplasma pneumonia and Epstein-Barr in healthy people. And what it means with with Epstein-Barr and Mycoplasma are these are germs that we cohabitate with the same way we live with bacteria in our skin. We can cohabitate with an Epstein-Barr. We can cohabitate with a Mycoplasma pneumoniae. And many of you may know from reading deeper into the materials I have online, I do not advocate doing specific treatments for Epstein-Barr or for Mycoplasma pneumoniae, because it is my belief, and also what I see in my practice, that if they are there, often dealing with your tick-borne infections and modifying all the lifestyle things we need to help you, like get sleep, be on adaptogens, exercise if you can, eat healthy diets, make sure and balance your intestinal microbiome. All of those things will also boost your immune system so that you can get Mycoplasma and Epstein-Barr under control. So generally, my approach is not to focus on those infections at all. So then to also answer your question about eradicating Mycoplasma pneumonia and Epstein-Barr, our goal is not eradication with those. Our goal with those is to get them back so that they're not bothering us, okay? All right. Drop the germ load down enough on those. Okay. Thanks, Ella. Good luck to you. Hello, Peter. Let's see, dear Dr. Ross, may I ask you a question about testing on behalf of my sister, Rachel, who is too unwell to attend at this hour? We're in the UK. Sure. She has been unwell for 9 years following 2 untreated EM rashes in Southwest France in 2009 and got significantly worse after COVID in 2020. Armin testing in 2024 was positive IgM Bartonella and Babesia, weak for Lyme and Ehrlichia. 10 months of combination antibiotics brought minimal improvement, and now she has since deteriorated, developing marked hypersensitivity to many medications and foods and cannot tolerate most mast cell activation syndrome treatments. Recent microscopy abroad, unvalidated, suggests high Babesia, low Bartonella Lyme. She plans mold testing and wonders if you would also advise further confirmatory testing for Bartonella Babesia, and if so, which tests given exposure in France, or rather, should she wait to reassess after the mold results and have clinically guided her treatment? Many thanks, Peter. Okay, hold on here a minute. There's a lot in there. Bear with me. I might just look back here. So it was antibody testing that was positive for the Bartonella and Babesia. Okay. So let me just make some comments here real quick. So when we see people that get progressively more and more sensitive. That usually means there is a component of mast cell activation syndrome, which you call MCAS here, okay? And underlying that could be too many yeast living in the intestines that are stimulating the mast cells that line the intestines. So number one thing to consider with her, and I know you have a testing question, I will get to that, but in terms of where to go, there needs to be some consideration as to whether she has a lot of sugar cravings, gassiness and bloating, maybe vaginal itching, vaginal discharge, maybe having more skin rashes or acne. Those are all things we see, and too many yeast. And if they're there needs to be found a way to help balance that out. Number two, mast cell activation is triggered by infection. So it can be triggered by Bartonella, Borrelia, Babesia, and too many yeast living in the intestines. In people that are hyperreactive and you can't even get them into doing some of the standard mast cell activation treatments, the one thing that I will often do is pull back and start to do something called limbic system retraining or brain retraining. There's an area of the brain called the limbic system that when you have chronic tick-borne infections can sometimes get stuck in an on position. That is the part of the brain that governs your release of adrenaline and anti-adrenaline. It is what governs whether we eat, our drive to have sexual, to have intercourse, to reproduce children, etc. It can run on autopilot. And there are 3 different programs out there that have data. The one that has independent data where researchers went in and looked independently to see if there's benefits from doing the program is a program called the Gupta program. Gupta is actually in the UK, and he's got data suggesting about 50% improvement in symptoms for the average person living with these illnesses by completing his program. The other competing programs out there, one is called Primal Trust and another one called Anti-Hopper Dynamic Neural Retraining System. Those 2 programs on their websites would suggest 50% improvement for people living with chronic illnesses based on surveys of patients, but not independently researched or independently verified, okay? So there's programs that are worthwhile. I prefer to have people look at the Gupta method just because it has independent research suggesting it would work, but those are some things to consider adding in, okay? Now, the problem is once you've tested positive for antibodies for a Babesia or for a Bartonella or for a Borrelia, once you've made antibodies, retesting is not a reliable way to see if they're still there or not. If they are still there, that may just be that the immune system has got a memory and is still making antibodies from having had the infections. And there is also the possibility that if they're negative, it's due not to the absence of infection, but could be due to the fact that the germs are raging and partying on and suppressing the immune system, okay? So IgM or IgG testing would not, no matter what lab you do it from at this point, would not give accurate information, all right? When one way around it, but it's not 100% accurate, would be to do the Elispot testing method that Armin offers in Germany and is also offered here in the States and through another independent lab called Infectolab here. And what happens in an Elispot test is that we take white blood cells from the person, in this case from your sister, and then we expose those white blood cells in a test tube to proteins found on a Bartonella or found on a Babesia. And then we see we measure if those white blood cells, T cells, release a certain pattern of cytokines. And if they do, that means they are reacting to that infection, and it means that they have seen that infection sometimes within the last 2 months. So the reason we say it's 2 months is your circulating T cells, which is what we use, T white blood cells, live in your blood for about 2 months. All right. So if you get a reaction on this test, the T cell reaction, also known as Elispot, it means they've seen that infection. Okay. Now, the drawbacks to the Armin, though, is that, and even Infectolab, is that they're not testing for enough strains. On Borrelia, they are testing, I believe, at Armin for 3 strains. For Infectolab here in the States, we're only checking for 1 strain, which is Borrelia burgdorferi. For Bartonella, both Armin and Infectolab are only looking to see if we have reactions against Bartonella henselae, but we recognize that there are maybe up to 15 other strains, or a total of 15 strains, I should say, that can, of Bartonella that can lead to infection. And so literally, Infectolab and Armin are not testing for those other strains. They claim there's cross-reactivity, but they don't have the science to back their claim. Okay, all right. And then Babesia, I think Armin is testing against 2 strains, and I think that Infectolab, I believe, is testing against 1 strain, but we think there may be even 15 strains of those. So the only way that an Infectolab or Armin Elispot T-cell reaction test has meaning is if it's positive. But if it is positive, it does mean you've got activity from those infections and it's a current infection. So that might be one way to go to just see, is there some evidence? But again, I caution you that if it is negative, it doesn't prove that these infections are gone. Okay, all right. Finally, there's another way here in the States that we can do it, and that is to do a microscope exam of your blood where we literally look for the germs, and that is using a method called a FISH test, which means we take a fluorescing marker that attaches to the genetic material of the germ, and then we look to see, can we see it under the microscope? So FISH stands for fluorescent in situ hybridization, which means we take this fluorescing agent, stick it on the germ, on the genetics of the germ, all right? IGenex offers a FISH test for Babesia and a FISH test for Bartonella. And if they come back positive, it means the germ is in you. It's a direct test. We literally are looking at the germ. The other lab that does it here in the States, but I don't know if you'd be able to get a test kit sent to the UK, you would have to reach out to the lab to see, is a lab called a TLab, that's TLAB, operated by Dr. Bob Bosignani, who's one of our leading Bartonella experts here in the state. And they are doing FISH testing for Bartonella and for Babesia. Now, the IGenex FISH testing is for the genus, the family of Babesia, which means it would detect any of the 15 potential strains. And for Bartonella, it is for the family of Bartonella as well, too, okay? One problem with FISH testing is these germs, especially Bartonella, may not readily live in the blood. So when you draw your sample of blood, a negative test may occur even if Bartonella is living in your cells because it's not in the blood sample, okay? Babesia, on the other hand, lives in the blood, so the chances of missing it are smaller, but a negative direct test does not prove the germ is not in you. A positive direct FISH test says it is in you, okay? So if I were your sister, let me just read one more thing here. If I were your sister, what I would suggest doing, it's not perfect, but it's the next best thing you could do, would be to do Elispot testing from Armin for all 3 infections. For Borrelia, Armin is testing for Borrelia burgdorferi, Borrelia afzeli, and Borrelia guerini, which are the 2 European strains. And so if it gives you a chance to see if the T white blood cells have still been trying to work on it. Again, if it is positive, that definitely means those infections are there. But if it's negative, it could be negative because they don't test for enough things. And also, Elispot testing can be wrong about 15% of the time on a negative test, okay? Likewise, you could do a Bartonella and you could do a Babesia there as well too, okay? All right. There you go. Not a perfect way, but that's the best we have for you. Good luck. Good luck to your sister. Hello, Olivia. Greetings, doctor. I contracted Borrelia spilmanani. I always hate saying that word. I botched it up. In Europe in early June 2025 and tested positive IgG for Bartonella and Yersinia. After 4.5 months of oxy and IV ceftriaxone, my neuroborreliosis symptoms began to worsen, tingling, twitching in legs, fingers, and legs, difficult walking. My immunoblot and IgM antibodies are increasing, but IgG antibodies are not appearing. I ordered the medications you recommended of cinnamon clove oregano, crypto, Japanese knotweed, trifortify, and ATP 360. What else do you recommend adding to this regimen? Okay, so let me just make a comment here. So we recognize, so when it comes to antibodies, there's two families. There's that we follow in infections. One is IgM and one is called IgG. IgMs are supposed to be the antibodies you develop acutely, and they are supposed to, and here are the words supposed to, go away by around 6 weeks to 3 months in infections, including Borrelia, including Bartonella, including Babesia, and then the immune system is supposed to transition to making IgG antibodies. There is something that happens in tick-borne infections where the conversion of IgMs and the immune system starting to produce IgGs does not always happen. We know that specifically for Borrelia from data that was collected by the National Institutes of Health about 20 years ago. They were funding 3 research projects here in the States looking at for people that had failed an original Lyme disease treatment, so they were documented to have Lyme either by bullseye rashes or by having Western blot testing that meets the CDC criterion, and they failed treatment, and they're months, years down the road, and they could enroll in the study and do long-term IV antibiotics and see if it made a difference. In the enrollment for individuals into that study, when they were trying to figure out who they would take into the study, they wound up requiring everyone get Western blot testing. And what we found on that is that 50% of people that had been previously treated were still making IgMs months, years after they had been treated. Okay, so it happens about 50% of the time. We don't entirely know why. There's some theories about it. There's some theories that there may be some damage caused by Lyme to the lymph nodes, germinal centers there, and they don't switch over to producing the IgGs. What is significant about this, and this is where I'm trying to go here with you, is this next point, okay? Regarding IgMs and IgGs, there's a big difference. There is what's there in acute and what should be there chronically, but also they have different activities that they do. IgMs are primarily responsible once they're stuck on a germ for getting the whole immune system motivated to go after that thing, okay? But IgMs do not result in clearing of the infection. IgGs are much smaller and can get into the tissues where germs live and can help clear them. So your antibodies that clear infection, that help the immune system get in there to clear it out, are IgGs. So when people are not switching over to IgGs, it makes getting rid of the infections harder because you're not getting the benefit of what the immune system can add to clearing the germs. And in some ways, the one of the main things you can rely on in this situation is, are you on germ killers that can do it? Okay. All right. So I just wanted to make that point. That's why I did that whole discussion with you. So one of the reasons you may not be getting better is that your immune system just isn't converting to those IgGs. It happens about 50% of the time. We don't know why. Okay. So back to your question, what could you add that would help in the case of Bartonella and the Yersinia? So I would look at, and this is more on the Bartonella side. I don't know what would work in Yersinia on this situation, to be honest with you. But on the Bartonella side, cinnamon clove oregano, and I use a product for that called liposomal cinnamon clove oregano essentials here in the States by a company called Dr. Inspired Formulations. Laboratory data looking at those oils individually shows that they both kill growing and hibernator persister forms of Bartonella, and they break down biofilm that can cover those germs. Okay, all right. And then oh, hold on a minute. Oh, I'm sorry. You've got Borrelia and IgGs for Bartonella. Well, I may have misread your question here. Just a second here. Oh, no, you did. I think you said for the Borrelia, the IgGs are not showing up, but you do have IgGs for Bartonella. So from a tick-borne infection standpoint, there's the Borrelia and Bartonella to consider. Again, the Yersinia, I tend not to go after, but so anyhow, the cinnamon, clove, oregano will go after both Borrelia and Bartonella growing and hibernate or persister forms, and in addition can help strip biofilms off of them, okay? Cryptolepis, based on Johns Hopkins University experiments, is useful at growing and persister Bartonella and Borrelia. Japanese knotweed is useful against growing and persister Bartonella and Borrelia, all right? The one thing to consider that you don't have on this list of the Trifortify and the glutathione and the ATP360 is there's another product I've been recently working with in people that have a lot of neurologic symptoms, and that is a product that has an extract from green seaweed. The extract is called Rhamnan Sulfate. It is found in a product called Arterosil, Arterosil. I'll show the product to you here in a little bit. Arterosil is made by a company called Jona.health, and it helps to repair injury to the lining of your blood vessels. That lining is called the endothelial glycocalyx. We think that Bartonella infects the cells that line your vasculature throughout the body, the blood vessels throughout the body, and lives in a layer of cells called the endothelium. So the way blood vessels work is you have the blood vessels are a tube, okay? The inside lining of that tube is called the endothelium. It's a layer of cells called the endothelium. And then in the center of the tube is where blood flows, okay? Now, separating the cells and blood flow is this layer called the endothelial glycocalyx. And it's kind of a mucousy substance. It's got little hair fibers that stick up. And what happens is when blood flows by these little hair fibers that stick up, it triggers a reaction where they will make nitric oxide. The endothelium and endothelial glycocalyx will make nitric oxide. Now, nitric oxide is needed to keep your blood vessels dilated, especially the small ones, especially up in the brain. Okay, so you get better blood flow deep into the blood system of the brain. And then secondly, nitric oxide is anti-inflammatory. Okay, so it's anti-cytokine. It's actually anti-inflammatory. What can happen, I believe, and we know from other infections that infect the endothelium, that if the endothelial cells get infected, the endothelial glycocalyx can get damaged. And therefore, you don't have the production of nitric oxide, or as a good a production of nitric oxide, which may limit blood flow of all your antibiotics getting up into the brain, but also just blood flow into the brain in general too. There is no science that says this happens in Bartonella, but knowing how Bartonella acts as an infection, it makes sense, okay? And in the number of people I have added in this product too, I have found some good improvements in the neurologic symptoms, including thinking. So again, that product it's an extract of something called Rhamnan Sulfate, which is an extract of green seaweed. And that ingredient is found in a product called Arterosil by a company called Jona.health. All right. So that's something to consider. And then the glutathione and ATP360 that you mentioned here are good ideas because the ATP360 can repair injured mitochondria throughout the body, including the brain, which happens when you have chronic infections and even mold toxicity. And the glutathione is an antioxidant that can help with that repair as well, too. All right. In terms of other things you might consider, if you can have your doctors help you with something called methylene blue. Methylene blue is a dye, is actually a clothing dye, but it also is used medicinally and has pharmaceutical versions that are made to treat a condition which is called methemoglobinemia. whereby the hemoglobin in your red blood cells doesn't release oxygen, but we have repurposed it into the world of Lyme disease because there is data showing that it can help get rid of growing and persister Bartonella. It also breaks up Bartonella biofilm, and it has good, even if you take a pill of it, it is so fat soluble, it has good penetration up into the brain. And so it has to be made by a compounding pharmacy, and a dose that I use and others like to use is 25 to 50 milligrams twice a day. Okay, so let me show you two articles that you can take, or two pieces that you can look at here. Oops, so let's go here. Okay, so this, oops, I guess I didn't log out here. It's meant here. All right. I hope you're all still able to see this. This is my Lyme information site. And this is in terms of finding information that I describe about Bartonella and methylene blue and arterisol. Take a look at this article called The Ultimate Bartonella Management Guide, where I discuss both of them. Okay. And then in terms of this product that has the Rhamnan sulfate in it, it is this product called arterisol that I just mentioned. Okay. All right. All right. Let me just see one more thing here. Yeah, it's still there. Good. Okay. All right. So let me come back here again. All right. Olivia, that's a lot of information. I hope that gave you some things to think about, though. Okay. Good luck to you. Hello, Mary. Let's see. My original got cut off. Question. Test that Stephen Buhner thought important for people with lung conditions. Mycoplasma, Chlamydia pneumoniae, Aspergillus, Pseudomonas aeruginosa, hypersensitivity pneumonitis. A rationale is stealth pathogen involved with the lung tissues. I always say that once bitten, forever vigilant. The pneumonia x-ray showed some concerns. I am planning to follow up with pulmonology and cardio. I want to be sure that the practitioner thinks about tick-borne diseases and how they might have affected my heart and lungs. I will be seeking someone who understands these things. Meanwhile, what do you think about Buhner's list of tests? I've been lucky to have been fairly healthy despite what I consider to be tick-borne disease immune mess and the tick-borne disease joint staph. So now having lung heart involvement is concerning. Thanks so much for any input. To be honest with, so I'm not going to be able to answer it. I know you've written a very strong question here. The problem is, I need to know a lot more about what symptoms you're having to help me determine if you should even bother testing for Mycoplasma and chlamydia. And we need to know more about what you mean by cardiac, heart, and lung symptoms. I can presume that I know what it is, but I don't know. So unfortunately, I would need a little bit more information from you. Okay. Sorry about that, Mary. Mary, if you want, I'd be glad to consider, you might even consider booking one of my educational medical consult visits where we can get into a back and forth. We can talk with each other directly, and I can see if I can come up with some ideas for you. If you are interested in that, and also if anyone here is interested in that, let me show you how you do that. All right, so this is my practice website called Marty Ross MD, or at Marty Ross MD Healing Arts. You would want to take a look at my appointments tab and hit this Learn and Book Now, and then read down here into how I describe my educational medical consult. With this type of visit, I can visit with anyone anywhere in the world. I give you opinions, but I can't prescribe. I can't make formal diagnosis, and I can't order tests, but I can give you a lot of information to work with that you can then take to other doctors, okay? or that you could use on your own. The other option to see me is what is known as my being a full doctor to you visit, where I can prescribe, diagnose things, and order tests. And you can read through here if that interests you as well too. Okay. Good luck to you, Mary. Hello, Sarah. Hello, Dr. Ross, and thanks for making time to talk to us. You're welcome. Questions. Does knowing what species of Lyme or Bart make a difference and what treatment is recommended? Can you explain what Bartonella and Lyme do in the feet and legs? What are fibrin nests? Thank you. All right. So, when it actually comes down to it, the approach we use for a Bartonella henselae or a Bartonella cantana or a Bartonella genius, for which we haven't noted which of the specific strains it is, any of the Bartonellas, we're pretty much going to treat the same. We don't make a distinction in terms of how we put together a treatment. The same would be true for the various strains of Borrelia, and the same would be true for the various strains of Babesia as well too. All right, so in practical sense, it doesn't change the approach of what we use as killers or as supports, lifestyle changes, sleep, etc. It doesn't change any of that stuff at all. All right. The only place it really makes a difference is you want to make sure when you're doing your testing that you pick up a test that is broad enough to pick up all the strains of Bartonella and all the strains of Babesia and all the various strains of Borrelia. And as many of you know that participate in these webinars, my preferred way of doing that is IGenex testing using the immunoblot method, which has the ability to see more of these than any of the other tests out there, and has a sensitivity, the ability to find these infections when they're there, of about 93 to 94%, which is pretty good. Okay. All right. Then, so in terms of what Bartonella do in the feet and legs, and Borrelia. So Borrelia is more often known to give joint pains, pain in the joint, and pain in the various joints. Borrelia can also give you some neuropathy, so you can get burning, numbness, tingling, tight pains, maybe shooting pains as well too. All right. Bartonella will often give a lot of inflammation in the tissues around the joint. So instead of feeling like the pain is in the joint, it sometimes is going to feel around the joint and will even be tender when you start squeezing on the areas around the joint as well too. Bartonella also can give neuropathy, so it can give you that numbness, tingling, burning sensation sometimes that people have. And Borrelia can give a lot of the muscle achiness and cramping. Bartonella can occasionally too, but when I got somebody that's more pain in the joints, muscle achiness, I'm thinking more Borrelia, versus Bartonella, I'm thinking more of when it's pain around the tissues around the joint, and the neuropathies going on. Additionally, Bartonella, one of the hallmark symptoms of Bartonella is pain on the balls of the feet. For some reason, it gives a pain distribution that is felt on the balls of the feet. Okay, all right. And then fibrin nests. So fibrin is a blood clotting protein that circulates in our blood, and it is recruited when you start bleeding to form a clot. Okay, so it's the blood clotting protein. But additionally, it is made in excess amounts when we have infections, so it's part of the inflammatory reaction. And Bartonella and Babesia have the ability to get wrapped up inside the fibrin, or get wrapped by all this floating around fibrin, and you wind up getting these nests of infection wrapped up inside the fibrin. Okay, so the nest can be made up of Bartonella, can be made up of Babesia, and will have fibrin in them. So that's what we mean by fibrin nest. If you were to talk to another doctor that doesn't work in the Lyme world, they wouldn't even know what you're talking about. It's a term that was actually coined by Dr. Harry Lindner, who is the doctor that describes and found a strain of Babesia called Babesia oticoli. He's the one that educated us because he found that to be a big problem in helping managing people living with Babesia oticoli. Okay, so but I think it's for description terms. I think it makes sense. Okay, all right. Thanks, Sarah. Good luck to you. Hello, James. Last week you mentioned looking further into the possibility of false positive IGenex fish. Do you have any update on that yet by chance? Yeah, I actually do. I spent some time talking this week with Dr. Shaw, who is the head of IGenex, and she's a PhD doctor. She's a laboratory I believe it's microbiology, if I'm right. But anyhow, so IGenex recently had to do validation, some updated validation studies, I think it was recent, and to be able to be certified to start to offer their testing in New York State. New York State has its own criterion on whether they're going to allow independent labs to send test kits in and out of New York State. And as part of that criterion, New York State sends a company like IGenex samples thought to have the infection and ones thought not to have the infection. And what she relayed to me is quite clearly is that their testing was nearly 100% accurate at correctly identifying what samples from New York State had the Babesia in it and which ones did not. So on the validation studies they recently did to get New York State validation, they did really, really well. What she wondered, and the trouble is I don't have samples to share with her off the top of my head. She wondered if the issue may be more that the Babesia immunoblots that are being done at the same time as the fish testing are being underread, meaning they may be weakly positive, but they're being reported as negative. Because what I was concerned about is I was seeing some situations where somebody would have a positive fish test and no antibodies. And I was starting to see that enough that I was wondering about false positives. What she has asked, what she would like to do is when I see that in further samples, is just to give her a call, and they're going to wind up looking to go back and reread those, the immunoblots and make sure that they were correctly read, that they weren't underread in a sense. But as I heard her in the validation that they've gone through, yeah, I think those Babesia fishes are probably accurate. Okay. All right. Thanks for asking that question. Okay. Hello, Mary. Let's see. Hello, Dr. Ross. Thank you so much for doing these webinars. Since you don't have a million questions tonight, I'll ask another on the chance it could be useful to all. Flare in joint pain after recent pneumonia antibiotics. I have a history of tick-borne diseases treated in 2003 with doxy, 7 or 10 days. Had all the typical symptoms of Borellia, I assume, given region, frequency of bites, monthly, sometimes daily. 95, 2000 had some root valley. I could have any number of things, probably Bartonella. A few years after doxy treatment, I developed weepiness, crying, JAGs, and depression 2007, and was treated for years with SSRIs. Over time, I developed joint pains, migrating, positive, SED rate, ASA that varies, sometimes negative, and is worked out for lupus and negative, but joint pain persists. I have a rheumatoid arthritis diagnosis, recent pneumonia treated with 5 days of levofloxacin situation. 1 day after finishing levofloxacin, I developed severe pain in new areas, all left side, hip, deep in the joint, never had before, knee, not as bad. Okay. And then I think there may be a second part to this. Hold on a minute. Sorry, this is joint. So my question is there anything special I should do given my situation above when I start the 3-EO therapy? All right. So a comment. So Levaquin, levofloxacin, has a side effect of inflaming tendons and connective tissue. In fact, in some situations, so the medicine actually has a black box warning on it saying that you have to be careful because you could get into rupture of the tendons. So it's not, it may be that this pain deep in and around joints may have to do with Levaquin, levofloxacin, having triggered inflammation within those tendons. Usually over time, it goes away, but not always, unfortunately. And so there is a situation out there that some describe as being floxed, where they have permanent symptoms that are there for having used a levofloxacin. In the world of Lyme disease, many of us used to use it regularly to treat Bartonella, but over time, given the times that I had people that developed side effect issues, either breakage of tendons or inflammation, I have stopped using them as a family because of the issue of potentially getting into some permanent injury from them. So it's not my favorite approach anymore. At one time it was. Many of us in the world of Lyme were using it, but I think a lot of us have stepped away from using that. So just keep that in mind. It could just be that some of this worsened pain deep in the joints, and maybe more from inflammation of the connective tissue around those joints triggered by being on the Levaquin, okay? And then let's see here. Oh, the other thing I would look at, so I know that somebody has said that you have, you've gotten a rheumatoid arthritis diagnoses, meaning you've got joint pain, and the way that a lot of these diagnoses are made in rheumatology is that they check off enough boxes about the way your blood test looks, where the symptoms are, et cetera, and then they say, oh, you meet enough criteria, we'll call that rheumatoid arthritis. But it doesn't automatically tell you how you got that, right? So what was the underlying situation that triggered that? There is also the question as to whether it's truly an accurate diagnosis, because it's just a matter of whether they check off the right boxes, basically. The one thing that that I'm starting to consider a lot more in my practice, but I do know from over time, is that if you've been on various antibiotics and you start developing joint pains down the road, one of the reasons it could be happening is due to intestinal dysbiosis, meaning an imbalance of the good bacteria and germs that make up your intestinal microbiome. And if you get an imbalance in those infections, it sets up an inflammatory situation within the intestines that can then leak out, and it can even set up something called leaky gut. And then you wind up getting inflammatory chemicals that leak through the lining of the intestines, get into the blood, go elsewhere in the body, and set up inflammation elsewhere. Okay. All right. I'm kind of oversimplifying the discussion, but that's what can happen. So often, if I've got somebody that's been on antibiotics and they suddenly start getting worse with more joint pain, more body pain, one of the situations I'll look for that suggests intestinal dysbiosis is if you get too many yeast, it creates an imbalance in the good bacteria in your gut, and it can lead to joint pains throughout the body. It can lead to more fatigue. It can lead to more muscle pain. And so when I see a situation like this, I'm always going to want to screen for too many yeast in the intestines as part of my consideration. The testing for intestinal yeast is not the most accurate. So I will do a screening questionnaire that I have that helps give me a good idea whether there's a lot of risk and whether it could be yeast. And if you score high enough on that screening questionnaire, over 140, then I have found treating for intestinal yeast can often make a difference, okay? And then more recently, there is a laboratory that is now available and it's called Jona, Jona. The website is Jona.health. So Jona.health. There's not a .com on it. It is literally Jona.health. And what Jona is doing is a pretty comprehensive analysis of your intestinal microbiome. And the way that they do it, it's a technique that is unique to them. They basically take all of the genetic material in your poop and they carve it up. And then they take the patterns that are there and compare it using AI, compare it to a database of every organism known to personkind, basically, and they see which ones are in you, okay? Now, that is a bit different than the way a GI map is done, a GI diagnostics through Genova. Any of the other labs out there are not carving up every piece of DNA in your intestines looking for all possibilities of what could be there. The way the other companies do it is they're basically using a marker that attaches to, I think, 23 organisms. That's all they test for. And they're looking to see what the balance is of those 23 organisms. But they may miss all the other germs that should be there, okay? So Jona, again, looks using their AI database, they can tell you what the germs are. And then because we've got this just astronomical growth of research on what makes up a healthy intestinal microbiome and what imbalances might lead to arthritis and what imbalances might lead to heart problems and what imbalances might lead to mental health problems and what imbalances might lead to dementia. I mean, literally, our gut is controlling so many different things in terms of functions in our body through the metabolites that are released there. Jona uses AI, then they figure out what the makeup is, the microbiome makeup is, and then they then look at the health problems you're having, and they go back and query using AI again to find out how do they create a better balance in your intestines that would work through the microbiome to fix some of these problems that a person is having. It's an interesting test. I've been having good luck with that. So in addition to considering whether you have too many yeast and treating for too many yeast if you score high on my questionnaire, I also am suggesting to patients in similar situations that you're in is to do a good gut analysis using this Jona microbiome test as well too. Okay, all right. So let me just do a quick screen share here for you. All right, so in terms of figuring out if you have too many yeast, I don't like that. Why is that doing that? This image is supposed to go away. Go away, image. Let me see what I can do to get that to happen. All right, now I'll try it. There we go. All right, so take a look at my yeast section here in my Lymology guides. And then look at this article here called "A Silent Problem is a Yeast." And then come down here. I talked to you about how do you figure out if it's too many yeast, but the cornerstone of figuring out is this yeast screening questionnaire that you would click on this and it would pull up my questionnaire. Okay, all right. And again, if you score over 140, there's a good possibility you have too many yeast, and I usually will just treat in those situations for too many yeast, okay? Good luck to you, Mary. Hello, James. Let's see. Any thoughts on using topical antibiotics via a compounding pharmacy for those sensitive to traditional oral antibiotics? I haven't tried it, so I can't tell you whether it works well or not. Having said that, let me reframe that. I recently, in a patient that had a lot of sensitivities, things going through the gut, I'm trying to see if we can give methylene blue. I think there was a second antibiotic we were looking at, doing a skin preparation just to see if it would work. But I can't tell you whether that outcome has been good yet or not. Okay. All right. Thanks for the question. It's a good question. Peter says, thank you so much. I'll pass that all on. You're welcome, Peter. All right. If you have parasites, heavy metals, and candida, what order should you treat in if you also have tick-borne illnesses? All right. So generally, let me try to clarify something. So parasites, I only treat intestinal parasites and Babesia, which is a parasite that lives in the blood. I do not agree with some people out there that think that every time somebody can get better from Lyme, it must be from some nebulous parasite infection in their blood or in their tissues. There is no data that supports that kind of opinion, and it's mainly opinion. However, if it is for intestinal parasites that can lead to body-wide inflammation, as I was just describing in my discussion about imbalances in the intestinal microbiome leading to body-wide inflammation, intestinal parasites could be behind that. And so that's my comments about parasites are about that, okay? Or Babesia as well too. So generally what I'd like to do in my approach, when I've got somebody that has a lot of intestinal dysfunction, and I think it could be due to candida or to intestinal parasites, I'm going to want to address those first. The reason I want to address those first is if I start using prescriptive or herbal antibiotics to go after the tick-borne infections, I'm likely to create further imbalances within the intestinal microbiome, which will make it more difficult to get inflammation and get immune support going, et cetera, for the person. So all things being equal, I probably would go for parasites and candida first in a situation where it's pretty clear to me there is a major problem of intestinal dysbiosis caused by either candida or parasites, okay? All right. Then I would probably layer in treatment for the tick-borne infections. Regarding heavy metals, I just am not thrilled with any benefits that I have seen for my clients where I've gone after heavy metals. And even though I know that they may have some elevations, when I go in and remove them, I don't find it to be the thing that gets them to do better. So I usually might look at doing heavy metals if we've tried all kinds of other things to move their illness forward and we're not making any headway. And the last thing I can see that maybe could be an influence, I might in those situations, more as a later thing I do, go after heavy metals, because again, I just don't find it to be, even with high numbers for the average person, it is not the issue leading to all the fatigue, body pains, cognitive dysfunction, etc. Okay. So most of the time it is not that issue, basically. Okay. All right. Good luck, Sean. So let me say one more thing about that too. So when you have chronic Lyme disease, mold toxicity, fibromyalgia, chronic fatigue, even long COVID, it doesn't necessarily mean it's one thing contributing. Often it is a variety of things that add together to create the health mess, okay? Now, so all the things could be heavy metals. It could be you got yeast in your intestines. It could be you have terrible sleep habits and you're not getting to sleep because of lifestyle problems. It could be that you have a horrible diet. It could be all kinds of stuff, all right? What I find, though, is you don't have to correct every problem to restore health. You just got to repair the right ones, and the body can deal with some of the other imbalances as long as you get rid of the big problems, okay? So the big problems that I like to address are your tick-borne infections, your mold toxins, getting sleep. Usually what you can do with sleep is work on lifestyle, healthy sleeping patterns, get the caffeine out, get the alcohol out, cool your room down at night. There's a whole bunch of stuff you can do to help with sleep, but get sleep. Lower cytokines, which is basically, this is my Ross support protocol, okay? So I'll just walk you through it real quick. So the big ticket items are literally what I list in the Ross support protocol. Those are the things you want to address first. Heavy metals is a later thing because it may not just make a big difference, okay? So let me just do a quick screen share here. All right, so here's my Ross protocol. And over here on this side, you can see there's a sleep, diet, balancing the intestinal microbiome, exercise, lowering cytokines, adaptogen would be like being on ashwagandha, balance your hormones, be on a good multivitamin, do some limited detox, not heavy metals though, deal with yeast, Lyme, and your Bartonella and Babesia. Those are the big tickets. Everything else is a sideshow until you deal with these things, basically. Okay? All right. Oh, yeah. All right. Let's see here. Let me go back. Hello, Lisa. Hold on here just a minute. So Lisa says, tested positive for ochratoxin A through Great Plains back in 2022, then muscle tested for Bartonella. I have done cell core protocols and others, but still have chronic fatigue with heavy weight feeling. Can you tell me what your protocol would be for these two? All right. So first of all, I would make sure you're treating the right thing. Your ochratoxin is the right thing. You've got some proof from a laboratory study that you have it. Muscle testing is not an accurate way to determine if you have a chronic infection. I'm not saying there aren't some testers out there that use kinesiology or use out here. There's a bunch of people trained by Dr. Dietrich Klinghardt doing a method called ART, which is a form of kinesiology. There are some good testers, but on the whole, I have been disappointed in what I see with testers when I start getting in there and look at the symptoms myself and then use laboratory as a supportive way of diagnosing. So I mean, maybe they're right, but boy, I would want to make sure you're treating the right thing. That would just be my thought on that, okay? All right. All right. Second thing, though, if you really do have Bartonella and you do have ochratoxin, for the Bartonella, herbally, you could take a look at, and this is in a starting point. Actually, for a starting point, let me just show you where I would look at first. Go back here. All right, so take a look at my support protocol. Look at this Bartonella and Babesia infections here. And then in terms of Bartonella, if you were wanting to build a all herbal option, one of the things you could look at doing is Houttenia, Sida Acuta, the cinnamon clove oregano combination. That's one option, okay? A second, and then if you're looking for a prescriptive option, you could look at these prescriptions that I have here as well too, okay? Now, I will also tell you another way to deal with Bartonella is this option I have under Babesia, Bartonella, and Borrelia treated all at the same time, which is to use a crypto, Japanese knotweed, cinnamon clove oil combination. Okay, so take a look at either one of these basically. Okay, all right. And then for ochratoxin, let me just show you how you would find that information on your own without having to rely on these webinars. So that's what I have this site for, so that you can look things up, okay? So in terms of mold toxicity, you could literally write in up here, you could write in ochratoxin. Ochra, there it is. It's part of this article called Mold Toxin Illness, okay? All right, and then down in here, I have a table about which binder does what. Okay, so this is binding agents for specific, and I apologize, it's probably very small. Let me see if I can blow that up a little bit. There we go. Okay, so you have ochratoxin, and there are a variety of binders you could use. You could use activated charcoal. So here's ochratoxin in this row here. So you activated charcoal. You could use cholestyramine as an option. You could use a bentonite clay. You could use diatomaceous earth. You could use humic acid. You could use NAC. You could use probiotics. You could use zeolite. Okay. Given that there's a number of things that would work on ochratoxin, usually what I would do is pick a product that has a number of these things in it. And the product that I like using for that is a product that is made by Biocidin Botanicals, which is called GI Detox Plus. Let me show that to you here real quick. It's this product right here. Okay. All right. And then, so just so everyone knows, I still have all my product pages. All of these pages have descriptions that are very much tailored for the person living with tick-borne infections. But I now have a partnership that actually sells these. So if you're on my site and you wind up clicking the Buy Now button, you're going to be brought over to my partner in doing all this. And that partnership is with a company called Phimologist. Okay. And so you would land on the Phimologist website. That is intentional. It is not clickbait. It's real. And basically they hold all the products for me that I want people to have, and they wind up being my sales arm for it. Okay. All right. So this is the Phimologist site. It's not clickbait. It's real. All right. And they've been a great partner for me. I've enjoyed working with them. They're providing really good service to my customers as well, too. Okay. All right. Oops. I guess I got to stop sharing. There we go. Thanks for that question, Lisa. Good luck to you. Hello, Tracy. Let's see. Hi, Marty. Is there any connection that you are aware of or could speculate about between tick-borne illnesses and polymyalgia rheumatica? So polymyalgia rheumatica, everyone, is an inflammatory condition of the muscles. And usually it's marked by a lot of muscle tenderness and a high sedimentation rate. And I also believe a high C-reactive protein. It tends to be an illness more of older individuals. And for the sake of discussion here, I'll say 60 and above. And I threw myself in that group because I'm 63. But it tends to be, it may even be in 50s, I think. But I tend to think of it as something that's older. And I have not seen any relationship between tick-borne infections causing it. Where I have had some issues, for instance, I've been managing a person here recently that the primary care doctors did not understand that he had tick-borne illness, leading to a lot of his muscle tenderness. And at that time, he didn't even have elevated SED rates. But because all of his muscles were so tender, and because of his age being in his 70s, they automatically assumed it was polymyalgia rheumatica and put him on steroids. And then we had to walk that back and try to say, no, there was no sedimentation rate elevated, no C-reactive protein. Yes, he's in the right age group. But once we got him on antibiotics for his tick-borne infections, that is what worked on him. And eventually rheumatology even came around and agreed with all of that as well, too. Okay. So the relationship is that unknowing people might think that any person with muscle tenderness in their 60s and 70s is PMR. It's not. You have to look back and make sure there aren't tick-borne infections that could look the same. And especially if you don't have an elevated SED rate and you don't have an elevated CRP, it's probably not polymyalgia rheumatica, also known as PMR. Okay? All right. I hope that answers your question, Tracy. Thanks for that. Hi, Lisa. Let's see. Also wondered your thoughts on muscle testing. I'm sorry if I was pretty hard about that, but I don't support it. I don't support it. I have no pain in the feet and no migrating pains. I do have depression contractures in both hands. Right now it's carpal tunnel, trigger finger surgeries on right, and ganglion cysts, also optical migraines. Moved out of a house with mold in 2022. Yeah, again, I think I made that point earlier, so I'm not going to address it further. Okay? All right. Good luck to you, Lisa. And Sean, I'm just going to post this. I answered this question for you earlier. I think that was from you, but I did answer a question about what order do you treat these all in. So if you missed that, look back at the recording probably about 20 minutes earlier from where we are right now. Okay? Tracy, let's see. Hi again. I forgot to ask the second part of my question. Are you aware of any subtle or meds that can help with complex regional pain syndrome? Supplements. I get it. Or meds that can help with complex regional pain syndrome. No, not. So complex regional pain syndrome, everyone, is a condition where somebody gets some kind of an injury that leads to pain in that joint, like they're hit or they have a crush injury. And then even after all the inflammation of that syndrome is gone, they're left with a lot of more or less neurologic pain. And we call that complex regional pain syndrome. Most of the methods for dealing with that are directed at trying to modulate the neurologic transmission of the pain. And that would be things like using your seizure medicines, using your antidepressant medicines. Those tend to be the ways that we do it. From a functional medicine or an alternative medicine standpoint, I tend to find some benefit in patients with these kind of conditions using acupuncture. Now, you have to be careful. You need to find an acupuncturist that knows how to be sensitive about putting needles in, especially in the pain area. But there are also acupuncturists that do more of what's known as a Japanese style acupuncture, which does not deal with deep needle insertions and sometimes can deal with just touching the skin. So I have found benefit in working with acupuncture in situations like this as well. From a supplement standpoint, nerves work better when you have adequate amounts of vitamin D. So I would want to be doing some testing about vitamin D levels, and I'd like to have people somewhere between 55 and 80. I don't try to go much higher than that, but vitamin D can lead to improved functioning of a lot of systems in the body. So I want to make sure that people have adequate vitamin Ds. I also want to make sure there are no B12 deficiencies or even folate deficiencies that may make it a little bit more difficult for the nerves to function correctly. But those would be the things I'm thinking of more from a natural standpoint, okay? Yeah, there you go. In terms of the anti-seizures, I mean, you'd be looking at something like a Lyrica, a gabapentin maybe. You might be looking at antidepressant medicines. Sometimes even the SSRIs may make a difference, but any number of the different antidepressant medicines might make a difference too, okay? All right. Good luck, Tracy. All right. Oops. Let's see here. Hello, Tina. Hold on just a minute. Let's see. Lyme mold with microgen DX, chronic UTI. Do you have an opinion? Long-term antibiotics and gut health declining. Max and what kind of probiotics is appropriate? Also, what is their 8 amount for number of pills of lumbrectinus, 2 pills a day? Tina, this is so cryptic. I'm having a hard time what the question is here. Do you have an opinion on long-term antibiotics and gut health declining? Oh, okay, got it. So you're saying in treating Lyme mold, your conditions are Lyme mold, chronic UTI, and you're wondering about the long-term antibiotics and gut health declining. Yeah, I mean, I would. There are concerns. The big thing, again, what I would do, a good starting point would be to assess the gut, and also to consider, do you have too many yeast? And so earlier tonight with another question, I said, fill out my yeast screening questionnaire, which if you didn't, I'm not going to go back through it again, but you can listen tomorrow if you missed it. But fill out my yeast screening questionnaire and figure out if you might have too many yeast, and look at getting a handle on what's going on with the gut microbiome by starting with that Jona.health exam to see if what the makeup of is. All right. And then you can use that to guide you as to how do you replenish with food, supplements, probiotics, etc. But instead of just kind of randomly throwing something at it, you'll have the Jona.health study as a guide. Okay, so that's where I would go with that. The other thing I would suggest is, more and more in my treatments, I work with prescriptions and I work with herbal antibiotics. It used to be at one time I preferred going prescription antibiotics. These days, especially with some of the more recent Johns Hopkins studies that came out 5 and 6 years ago, I now use as a starting point herbal antibiotic regimens with most of my patients. I give everyone a choice. I mean, if somebody comes and says, I want prescriptions, I'll work with prescriptions with them. But more and more, I'm leaning more towards the herbal side because it does pretty good. On the Borellia side, I think it has some equal efficacy to doing prescription antibiotics. Bartonella and Babesia, it may be about 5 to 10% less effective, but it's still a good starting point. And if it just so happens that the herbal antibiotics, and I'm talking for chronic, acute Lyme, I would still go with Doxy. Okay, Doxy is the only thing really with science showing it works. But for chronic tick-borne infections, my starting point more often than not is herbal remedies because they tend not to have as much harm to the intestinal microbiome. So that's a long way of saying I would work with your providers to see if they might be able to help you come up with herbal antimicrobial regimens rather than using prescriptives to protect your gut as well too. Okay. All right. Regarding the max and what kind of probiotics, again, given how long you've been on antibiotics, I think you'll find some merit in looking at the Jona.health study as a means of guiding you to what should be in a probiotic. Okay. So different germs do different things. Okay. Or different probiotic germs do different things basically. All right. And then also, what is there about for? So regarding lumbrokinase, it all depends on the person. So lumbrokinase, again, we can use for a couple reasons in these illnesses. One is lumbrokinase, which is a group of enzymes that come from earthworms. I think many of you know that. It's useful at helping to break down fibrin. Fibrin is a component of biofilms, which is a slime layer held together in a protein skeleton that can cover Bartonella and can cover Borrelia. I haven't seen any literature saying they're involved in Babesia, but we do know they can be for sure involved in Bartonella and Borrelia. So lumbrokinase can break down the fibrin skeleton that holds these biofilms together, so it can be useful for that. The other reason to use it is that it is useful at breaking down fibrin that are part of Bartonella and Babesia fibrin nest, which is basically fibrin wrapped up in a bunch of germs, and they get stuck on your blood vessel walls and they're hard to get at, basically. All right. So the lumbrokinase can break that down. I try to get people for those conditions on at least one pill 1 time a day. If they're able to tolerate it, and if it doesn't cause severe Herxheimer reaction, because sometimes it does, then I'll try to get them to go up to 1 pill twice a day. But the timing gets difficult because you need to have it on an empty stomach, although water is okay, but you want to have it on an empty stomach because the lumbar kinase is a digestive enzyme. And if you have other things in your stomach at the same time, it's going to try to digest them and not get absorbed to break down your fibrin, all right? So I usually tell my clients to avoid taking everything about an hour before, and then take your pill, and then an hour later, you can start taking things again. So there's a 2-hour window around when you take your lumbar kinase. That can be hard to do if you're going to do it twice a day. So in those situations where one pill twice a day is too difficult to time, then I suggest that people wind up taking 2 pills 1 time a day. Okay? All right. Good luck to you, Tina. Sean wants to know if I would answer his question about the order of treatment. So Sean, in the previous question that somebody asked me about parasites, yeast, heavy metals, etc., I did address the order in that question. So I'm not going to come back and answer it again. Okay. Hello, Sarah. Is there a substitute for Sida Acuta? It really screws up my blood sugar, makes my hypoglycemia worse, and then it takes months for blood sugar to even out. All right. So, Sida Acuta is an herbal antimicrobial that is promoted by Dr. Stephen Buhner, master herbalist, to be effective against Babesia, Bartonella, and even Borellia. I will tell you that the scientific foundation behind those being effective is actually limited to almost non-existent in the Buhner books. Right? He has his rationale for why he came up with those recommendations. He was always science-based, but there aren't any studies recently that actually show it's effective against those. And so there are alternatives you can use. So if you're using Sida Acuta to treat Bartonella or to treat Babesia or Borellia, a good substitute would be Cryptolepis. Cryptolepis, which we know from Johns Hopkins University experiments about 5 or 6 years ago now, is very effective in the laboratory, and I see clinically effective against all 3 germs. So if you're using Sida Acuta to treat all 3 of those, Cryptolepis. If you're using Sida Acuta mainly for its action against Bartonella and Borrelia, then you might look at a Japanese knotweed would be a good substitute. Okay? All right. Good luck to you, Sarah. Why is that not? Oh, there it is. Deborah says how to treat Morgellons. So, Deborah, I'm going to direct you. We're getting a little bit late here. I'm going to direct you at an article I have on it, but I'm going to just do a quick piece on that, and then I'll show you the article. So ultimately, Morgellons, everyone, is a skin condition that people sometimes get in tick-borne illnesses. And I believe that the majority of Morgellons is a skin manifestation of the mess created by having tick-borne infections. So what most of us find the treatment for Morgellons, Deborah, is to treat your tick-borne infections. I'm just doing a quick summary, okay? Now, it can be a little more complex than that, so I'm going to show you the article that you can take a look at too. All right, that's my article. Okay, so take a look there, and hopefully that'll give you the information that you need then. Okay, all right. Good luck to you. Hello, Wendy. Let's see. Can you please talk about heavy metals testing, best company to use, and methods you prefer? Are we required to have a physician order these tests? Thank you for all your help. All right, so the thing about heavy metals, and I'm going to explain one aspect so you'll understand what I suggest doing. So heavy metals, basically, if they get in your body, will be absorbed into your cells, and they will impact how an area of your cells work called the mitochondria, okay? So they're intracellular. That's where they get stored. The issue, if we were to do random blood testing, is that most of them are stored in your cells and not in the blood. So random blood testing is going to miss what's happening at the level of the cells. If you were to do hair testing, which is another way that some people will do it, hair is going to basically give you a pool that develops over months. So like my hair length, that would be about 2 months. If you were to pluck my hairs, you would see what it accumulated over 2 months. So you get my point. The bigger the hair is, the longer length of time that it represents. So it's an average of what is in the body over a 2-month period of time, but it doesn't necessarily reflect what is going on in the cells. It may reflect better what has been exposed and got cleaned out of the blood, but not necessarily represent what's in the cells. So what you're interested in is what's in the cells. And so when you do heavy metal testing, the best way to do it is to provoke the body, the cells, to release their heavy metals. And to do that, we use a heavy metal binder, and we have you take a certain amount of that binder, and then we have you pee, and we collect your urine. The company I like to do that with is called Doctor's Data. The agent that I tend to like to use is something called DMSA that has to be compounded by a compounding pharmacy, okay? So yeah, this is something that I usually do suggest you have physician help to figure out if you have it, okay? All right, good luck to you, Wendy. Bonnie says hello, and she wrote us a question here. Let's see. Are the protocols the same with animals? Because after treating my horse over 10 years and not having great results with doxyminocycline, the best results were with intramuscular injection of cephalosporin with positive results after 4 days to a week. Lameness symptoms disappeared usually. I don't know what the protocols are for animals. I'm a human doctor, and I just don't know it off the top of my head here, Bonnie. So sorry about that. All right, everyone. That's it. I think we got through about everything tonight. Let me look over here. We did. We've got through every question, and it is 5:30 p.m. Seattle time, so we got through it in time. So good to be with you here tonight. I hope you'll join me next week, and I hope you will invite your friends that are people you know that have tick-borne infections to join us so that they'll get some benefit out of this as well too. And tomorrow when I send out the email, send it to people you know that might benefit from it. And then for those of you that are interested, I still have plenty of room in my clinic as I just reopened here in Seattle. So I'd love to help you that way if that interests you as well too. All right. Good night, everyone.